Okay, I can answer that question. Things will becomes much clearer in time when we complete the vaccination. Say, for example, early next year, 2022, first quarter, we expect to complete the vaccination for 70% of population by the first quarter 2022. At this point of time, it is not the immunity passport. This is globally. We also follow the guidelines by WHO. As you have heard just now, the discussion, a lot of questions regards to whether short term. Yes, we know there's a protection short term. What about the mid term and the long term? So before we come up with in terms of, I think CDC came up with a guideline saying that if you have been vaccinated, probably we can actually reduce the quarantine or no quarantine, for example. So I think we are looking into it. Things will change over a period of time. So as you see, this is the evolving period. We are not looking into a Malaysian perspective, but a global perspective. Whether once we have vaccinated, we'll look into the response and evaluation of the vaccination program. If it's a very successful, maybe there come a time that we will consider at that point, in terms of immunity passport, traveling, etc. But at this point of time, not yet. So I think we are just watching closely.
Tan Sri, what about 3S and 3W?
Yeah, there's no choice. We have to comply, because this is what our strategy number 5. You have to comply to the new norm, because this is the 2 strategies that we have, rather than you have only 1 strategy. Don't forget that even you have been vaccinated, you can carry the virus and then you can infect the virus to another person. Possible. Or you get a mild infection. So it's also possible. So you need to practice both public health measures as well as vaccination. So then I think you'll be complete. Then you can actually protect yourself and your family from the COVID-19 infection.
So Tan Sri, so would you say that, let's say someone gets vaccinated in March this year, and so all the way until January 2022, the person still has to do the 3 Cs, the 3 Ws and all that. And it's not like once they are vaccinated, it's over. No.
That's exactly what I'm trying to say, because that's the guideline from WHO. Unless, when, say maybe 6 months down the road, and then they look into new evidence to support that, we can actually allow traveling or immunity passport, then WHO will make the announcement. But to date, at this point of time, we do not have strong evidence to support that, once vaccination, you are free to do go back to our own lives before. So I think we need to live with the virus. So to live with the virus, 2 strategies. Comply to the SOP, discipline, plus vaccination.